right here on the Talk to Me Network, home of Helping Seniors of Brevard. And Helping Seniors of Brevard with your host, Kerry Fink. And Kerry is the executive director of the organization as well. That's coming up next. Good afternoon, Kerry.
Well, thank you, John Harper. It's always great to be here on the radio every Wednesday at 12 noon right here on 90.3 FM, WEJF. And thanks if you're listening in online at WEJF.net. And for those of you who catch this as a podcast later, we're so grateful for you as well. In fact, we find more and more people are finding this in the podcast world because maybe they're driving along and they hear this show and say, wow, this is a good topic. I know somebody could benefit from this material. And then they send them the link to the podcast. Or maybe you were in your car running errands and you missed some part of it. You say, wow, I wish I heard what Kerry and Dr. Lee Sheldon were talking about today. And so then they say, okay, that's great. I can go back and pick up the podcast. You can also find these on our YouTube channel, which is Helping Seniors of Brevard. And you can find these as well on our Facebook page, Helping Seniors of Brevard. And of course, you can find them on our website, helpingseniors.brevard.org. And so with that, it's a pleasure to welcome our very special friend of Helping Seniors. He's been helping us since the day Joe Steckler started this organization back in 2011. His name is Dr. Lee Sheldon, noted area periodontist. He volunteers his time on our board and is just a great blessing. How are you, Dr. Sheldon, today?
You're the blessing, Kerry. You've taken over for Joe and you're just moving the thing forward more and more and more. There are so many things that are happening within Helping Seniors of Brevard. So I thank you for your leadership.
Oh, well, you're more than kind. We are excited because, when Joe set this vision in motion back in 2011, which is interesting because you were helping Joe. We always joke you're the guy who got him onto into media anyway. Between you, I think John Harper helped get Joe onto the radio, but you helped him get his TV career started, and all that was back in the days of the Brevard Alzheimer's Foundation and all the good work that you guys did putting that together. And then when we met Joe, he was like, we got to do more for seniors. So here we are 15 years later with all kinds of stuff. Through Joe's kind of vision for all of this, we have the Senior Resource Center, a 5,600 square foot facility that the fine folks, Dr. Delegdish and the team at Omni Healthcare have made available to us so that we have a location for our senior helpline, our podcast studios, everything that we are doing, and so many good resources. We have a lot of great resident partners in the center as well. And of course, it's the home for our fourth Thursday senior information series. We'll talk a little bit about that as we get along on today's show. But let's dive into this. We're going to have a conversation about surgical skill making a difference in full mouth implant cases. And, I love these conversations because one of the things that I usually diatribe a lot about, Dr. Sheldon, is people see ads on TV for anything that could be what I would consider senior related. And sometimes they just gravitate toward the ads because they're slick, they're highly produced. They could say things like it's your favorite TV star from the 1970s that you used to love to watch on that particular program, and there they're on TV and they're telling you how they're going to simplify your Medicare insurance. The problem is when you call that 800 number, you're going to call a call center in, Iowa, and you're not going to talk to your favorite TV star. You're going to talk to somebody who's probably going to try to be helpful, but they're looking on a computer screen instead of just the same way you might be doing at your own desk or something, except they're not able to physically walk in and meet and shake hands and see what's really going on. If it's about Medicare, you need to know who your local doctors are. If it was, for example, about the paperwork you might need, legal, wills and trusts and things like that. They would say that they're familiar with Florida law, but wouldn't it be better to have somebody who has experience with how the Florida law is changing up to date and things like that? And Dr. Sheldon, I see all those national commercials that say, oh, you could get, just drop by this place and you could get, your teeth done in an hour, things like that. And I know you kind of pioneered a lot of that, but I still come back to there's something about dealing local.
There is something about dealing local. I mean, this is going to be the first program, Kerry, where we actually talked about the benefits of dental implants. Do you realize that? Do you realize how many times we've talked or said, you don't need an implant here, you don't need an implant there, you don't need an implant here, and our business is dental implants, so I guess it's time to talk about dental implants too. But yeah, I mean, the things that we see on TV now are things that we pioneered in our office in 2008.
Wow.
And we did it before they did. And so we always prided ourselves in being ahead of the pack. And we've got something which, by the way, has to do with assessment. It has to do with skill. It has to do with foresight on the part of the dentist. It has to do with the training of the staff. It has to do with good communication skills with the patient. It has to do with a lot of things that are provided by certain practices. We're not a one size fits all. And so, in one sense, it's okay, you've got a 10-minute assessment and we can do this. And the other sense, it's you're with us for 2 hours because I want to make sure you have all your options available. But what's really neat is that we have an option now that very, very few people, any place in the country, are offering. And we've tested the concept for now 3 years. And so now we can release it to the public and say, yes, we've got something that's so far advanced over what you see on TV that, we're proud of it. Not proud of it just because we're good at it. And that's Dr. Furtado and Dr. Matt Sheldon are good at it. And we've tested that concept that way. But in terms of patient's comfort, patient's ability to chew, the lower profile of the prosthesis, meaning it's not as big, the less surgical treatment that's involved, but that also means precision of the surgery that is involved. All of those things are now in place so that patients can have something that's far different, and we feel far better than what you see advertised in other places.
Yeah, I was thinking over the quite the variety of television programs and radio programs and columns you've written over the year. And you're right. So many of them actually just remind people that dental implant is not always the answer. In fact, I think we've done shows on topics like too many teeth being extracted. And you have shared some of the things that we want to make sure we go into eyes wide open as it pertains to dental implants. But I think one of the things that's fascinating is you have such a history with dental implants. I jokingly call you either the father or grandfather, depending on how you want to look at it, of dental implants, since you were kind of pioneering the field back in the days. But this is something called solid bite precision, as I think what this is called. But let's start with the history. You were part of the first computer-generated full arch dental implant procedure here in Central Florida. I mean, what was that like? And then how has it moved up till today?
I'll tell you, it was fun. It was a bit nerve-wracking. There was an awful lot to learn because we were doing computer design at a time when computer design wasn't commonly being done. And it didn't mean I was the first one, but I learned from somebody else to be able to do it, so that we were the first to be able to surgically place an implant on the computer screen in order to be able to determine how we would be doing our surgery later on, and to develop a surgical guide or a template or something that would be fastened to the mouth so that whatever we designed on the computer would be done exactly the same way in the mouth. That was 2008. And that was exciting. And I don't know how, I know there was nobody in Orlando doing it. I know there was nobody in Brevard County doing it. So it became a news event. And Florida Today was there watching the surgery. It was so cool. And so, our treatment rooms, by the way, a dental treatment room is called an operatory. Our operatory was filled with assistants in our office. There were some outside people. There were laboratory technicians. There was the news media that was properly draped, and there we were doing the procedure. And the first patient that we did it on was a favorite of mine, and so And he knew he was the first one. He knew it. And so, yeah, on that day, we did put the implants in and we put the heat teeth in all on the same day. And wow, okay, so then we had a newspaper article. And I think there were other news media events that occurred that spun off from that. But it was a very, very, very exciting time. Was I nervous? No, I mean, not really. My first implant I'd done was 22 years before that. So it isn't like it's the first time I've done a dental implant. But to be able to harness computer technology, and of course, now we're talking about AI and all sorts of things that we can do, but not at that time. At that time, it was being able to work the computer and to work the software and to be able to work with a laboratory. And there were only a few laboratories who could do what we wanted them to do, to be able to create what we wanted. Yeah, it was an exciting time. And I worked with a general dentist on it, so that I was doing the dental work and the general dentist was doing the prosthetic work. And he and his team were also in the treatment room. It wasn't quite like seeing how many people you can fit into a phone booth, but it had that feeling.
Well, you've always been kind of like cutting edge, and I think it's interesting to note that along the years that I've known you, I have seen you continually reinvest into like always trying to find the next level in everything from dentistry and periodontics. I mean, I remember years ago you sharing with us something called a perioscope, and I'd never heard of such a thing where you can actually look under the gum line and kind of see what's going on with roots of the teeth. And then I've watched over the years, because you've had upgrades and the technology just gets better and cleaner and crisper, and it just gives you more tools. And I guess that's why we've talked about it before, but literally practices around the country seek you guys out because they want some expertise to learn how you're running your practice, but also you're also involved in all these research projects, or you're always busy trying to find like what's the next thing that's possible here. And it sounds like the solid bite precision is something that's once again moving out into the forefront.
Yeah, it is. And this, I take no credit for solid bite precision at all. This is all coming from Dr. Sheldon Furtado. It was he who decided 3 years ago to follow somebody first in Spain who was doing this kind of work. And then he found out from the person of Spain who the person in Spain was learning from. And that person was in Portugal. And Michelle flew out 3 years ago in October, then November, and then December. 3 separate trips to Portugal in order to be able to learn the skills that were being imparted by this dentist in Portugal. So what's the principle here? The principle here is minimal surgery and maximum aesthetics. That's as opposed to, we're always good at aesthetics. We're good at it. But in order to be able to do the typical things that we were doing, there was a prosthesis, and the prosthesis meaning fake teeth, and it was one arch of fake teeth, and it was fake teeth and fake gums being attached to a screw attachment, which was the implant. Mm-hmm. And there's a line between the prosthesis, between the fake gums and the natural gums. And so we always had to hide that line above the smile line, because when you smile, you don't want to see that gap. And so we'd have to cut away quite a bit of gum and quite a bit of bone in order to be able to accomplish that result. It's quite a surgery when you're cutting away 5 or more millimeters of bone. That's a lot. And so, but that's the way these prostheses are traditionally done, and that's how we did it, and that's how we were doing it for many years. And the question that we were asking is, how can we do this procedure without cutting away the gum and bone, and yet produce an aesthetic result so that when you smile, it looks natural? And that was, we've been talking about that for a while. Michelle and I have been talking about that for a while. Matthew, the 3 of us, as you know, we meet weekly. It's Tuesday at 4 o'clock. We have our meeting. And that was part of it. What can we do to minimize the amount of surgery? Well, it takes some precision. In other words, you have to be able to extract the tooth and put an implant exactly where that tooth was in order to be able to get things to line up properly. The other thing you have to do is to look at the papilla. Now, the papilla is the gum tissue that's between teeth. It's the papilla. The papilla is the soft tissue that comes down or comes out between the teeth in order to be able to form the scallop of the tooth. And the scallop, or the shape of the tooth, is not the tooth itself. It's really formed by the frame, and the frame is the papilla. And so the question is, what can we do to retain the papilla? And Michelle and Matthew have been working hard over the past 10 years to retain the papilla in single implant cases so that we would have a natural looking single tooth that didn't have recession of the gum tissue on either side. And so understand, whenever you're building, you build from the simplest and master that, and then you move to the more complex. And in this case, the more complex is all of the teeth in one arch, meaning all of the teeth in the upper and all of the teeth in the lower. So we mastered the retention of the papilla in one tooth, and then two teeth, and then three teeth. And so now the next step is, all right, full arch. I mean, you can do a number of teeth. Once you've mastered a number of teeth, how do you go to the next step? And that was what Michelle learned when he went to Portugal. What was this person doing? Now, when you extract all the teeth, the papillae naturally go away. In other words, if somebody's wearing a denture, you don't see a denture with a scalloped ridge, you see a flat ridge. And so the natural tendency, once the teeth are extracted, is for the ridge to flatten out. And if the ridge flattens out, then you don't have these elevations or papillae between the teeth. And so there has to be a finesse move to recreate the papilla surgically, either by adding gum tissue or by subtracting a little bit of gum tissue in order to be able to create that scallop. Michelle worked hard at that. We're seeing patients for a number of visits, and some patients still need a number of visits because some people need more plastic surgery than others. But that's what he did. He worked with patients, finessed the tissue, moved the tissue in the right position. He and Matthew were adjusting the prosthesis in order to be able to retain the papilla, because the temporary prosthesis forms the template for those papillae. And they worked, and they worked, and they worked, and they worked. And now we've got it to the point where not only can we do it, and we can do it predictably, and there's some patients that are going to be more predictable than others, of course. That has to do with how much bone the person has. But we can do it more cheaply because we've gotten faster at it. And because we get faster at it, a patient is paying for surgical time. So now we can do solid bite precision for the same cost as regular solid bite. That's a tremendous savings for the patient. Everything in this world, particularly in dentistry, goes up and up and up, particularly on the sophisticated work. And Michelle and our entire team have worked hard to get that fee down, and that's because Michelle got better and faster at it, so we're able to accomplish it better and more easily, so patients can take advantage of this. So now our full arch prosthesis is no longer what you see on TV. Our full arch prosthesis, sometimes we have to do it because the patients have very little bone. That's the only way you can do it. But we don't have to cut away bone anymore in order to be able to create what we need. And at the same price, you can have something that works very well. It's much smaller because instead of having fake gums, you have your real gums. And so essentially, it's your natural tooth shape with very little, if any, additional material above where the tooth would be. So it feels more natural. Patients, when they have the other prosthesis, it's thick, it's big. Your tongue has to get used to where it's going to be. You have to learn how to speak again. All of those types of things. Yeah, you still have to learn how to speak again whenever you're changing your teeth around. I got some veneers. I had to learn how to speak again. But the profile of the prosthesis is so much smaller, so much easier to take care of, so much like natural teeth that it's just a giant leap forward in dentistry.
As you were talking through that, I was thinking about the fact that one of the things that I've learned from working together with you on all these TV shows, radio shows and such, is I think we're raised with this understanding that we see the ads on TV and they tell us brush our teeth because we don't want cavities. And yet, as you were just covering that, I thought we really don't get enough education in the value of healthy gums, and I think that's one of the things that I learned through working together with you, is that even as we're describing what can happen here with Solid Bite Precision, all roads lead to healthy gums, make everything easier. And as you have this Solid Bite Precision plan in place, it seems like in the long run that's still even more so part of that equation.
It is. When we're talking about healthy gums, we're talking about making the patient free of disease. So we've got cosmetic gum tissue, which is what Michelle is creating now. But everything that we put in the mouth, everything is in the mouth, whether it's a natural tooth or whether it's an implant, is subject to the disease of periodontitis if it's natural teeth, or peri-implantitis if it's an implant. And so the ability for the patient to be able to care for the prosthesis and care for the implants is improved because you've got a lower profile. It's easier to floss underneath that area in order to be able to clean it out. It's one thing to be able to get the prosthesis in place. The next thing is to keep it in place. And so all of our efforts, once it's in place, is we don't want to do this again, do we? So it's everything that we can do and the patient can do to be able to maintain things. And Solid Bite Precision is easy to maintain.
Well, it really seems like there's a lot of advantages here. First of all, it's less invasive, which I think has got to be helpful. I mean, anytime, I don't know about most people, but I'm pretty squeamish about things like that. So I think less is better when we're doing it the right way. And it sounds like kind of the approach that you're able to take really offers a lot of advantages to patients, because you've got the financial advantage, but then you've also got the fact that it seems like the less you do, maybe the faster you're going to heal up and be ready and be 100% where you want to be. Am I saying that right?
You're saying that correctly. Understand that when I was doing the surgery, and everybody knows here that, or most people know here, that I did the surgery. That was what I did. That's what I did for a living. And when I was doing this surgery originally, I would have the patient smile so I could see where the upper lip was, so I knew that's how far I had to cut the gum and bone back in order to be able to do the procedure. My goodness, that's the patient's own gum and bone that I had to cut away in order to be able to hide a line in a prosthesis. Does it take some skill? Yeah, you're darn right. Does it take a little bit of finesse? Yeah. Does it have to be able to harness all of the factors and all of the other factors that we have in order to be able to hide the implant and make sure the pill is prominent? Sure, it requires more skill than when I was doing it, but
amazing how the technology continue to improve so that we are able to do that. We're talking with Dr. Lee Sheldon of Dr. Sheldon and Furtado Solid Bite. You guys are known for being like the tops of full mouth restoration. I mean, we've done shows together on A Beautiful Smile. I did a show with Dr. Matt Sheldon, your son, who is a top-notch general dentist, and he was talking about some cosmetic techniques that really are very affordable. And then, of course, Dr. Michelle Furtado, who's now doing the periodontal surgery. He's obviously at the kind of the head of the class here with this whole idea of Solid Bite Precision. We're getting close to taking a mid-show break. I want to share with everybody a great program that you guys do have called the Solid Bite Gives Back program. And the reason that's such a blessing is it helps us as a charity. Helping Seniors of Brevard benefits when you take advantage of this program, but really you benefit by taking advantage of the program, because what you're going to get is what amounts to a $700-800 introductory visit and really get a sense of everything that's going on in your mouth, where at the same time, you, Dr. Sheldon, from the medical side, you guys are getting the full scope of everything that you need to be able to correctly diagnose and make the best recommendations for the patient. So can you talk a little bit about the program and how people get into that?
Yeah, in order to be able to see what I want, I don't want to say, well, good, come in for the examination. Now I need a full series of x-rays. Now I need a CT scan. It's going to cost this and this and this. I just didn't like that. So years ago, I said, I'm going to get everything I need. We're going to work with Helping Seniors, and if patients give a donation of $50 or more to Helping Seniors, then they can get the examination, the x-rays, including the CT scan, all for $50 or more to Helping Seniors from Brevard. call the office and say, I want the Helping Seniors program. And anybody who answers the phone will know what that's all about. And the office phone number is 321-259-8000. Or if you're listening to this late at night, go to solidbite.com and you can make an appointment online as well.
Oh, well, we've gone high tech in every sense of the word. Dr. Lee Sheldon with Solid Bite Dental. Dr. Sheldon and Furtado right there on Sauna Road, where you guys have really held down that corner for years. I keep seeing the newsletters that there's like a great new new facility being constructed. This is exciting as we're watching about all that too.
I don't know if I have time to talk about it. That's an interesting story, but maybe it's after the break.
Okay, well, we'll go for our mid-show break and talk about the new home that's coming soon for Solid Bite, Dr. Sheldon and Furtado. Just real quick before we get there, I just wanted to remind you that you can find all these broadcasts right here on helpingseniorsofbrevard.org. Every time we do a radio show or a TV show or we publish in Senior Scene magazine, we always archive these things because we find people like to hit these things when they're in the, I guess, kind of the mode of looking for something in particular. Like, so somebody who might be searching out for dental implants and trying to get informed and educated about that is probably going to find a show like that by coming to the Helping Seniors website, typing in dental implants, and there'll be a whole slew of programs that we've done together over the years. And then you can kind of pick and choose. And we see people do that a lot. We see them do that with the same thing happens when people are getting into the podcast and such. So one of the reasons that Helping Seniors exists is actually to be able to connect seniors and their families to the resources going to make a difference as they are aging. So we'll be right back with the second half of Helping Seniors Radio. We'll look forward to having you right back here in a moment, and we'll continue the conversation with Dr. Lee Sheldon.
Right now, let's get back to more of Helping Seniors of Brevard. And once again, here's your host, Kerry Fink.
Here we are, back for the second half of the Helping Seniors lunch hour. Every Wednesday, we love to get together at the radio. Hope you are enjoying your lunch, if that's what you're doing, and hope you are enjoying listening to Helping Seniors Radio, because we sure do enjoy the opportunity to present good information and good things that are going to help you. As Joe Steckler, our founder, often call it an aging plan. We kind of euphemistically call it getting your ducks in a row, but we kind of feel like the more prepared you are, the better you're going to be able to navigate. And knowledge is power. And that's one of the reasons we love having our very special guest, Dr. Lee Sheldon, noted area periodontist, who is the head of, has been the head of Solid Bite, Dr. Sheldon Furtado, for all those years. Although you kind of have passed the reins on a little bit, you still remain very, very involved, consulting on all the cases and making sure all is going in the right direction, including something that we were talking about just as we went into the mid-show break, and that was about the new office that's coming. You guys have been a landmark, really, on Sarno Road. You can't really drive down Sarno Road and not see the big sign and everything where it says Dr. Sheldon and Furtado Solid Bite. But that is going to be changing after a while here, right?
Yeah, it is. New building has been planned, and now our target date to open is September 2nd. So it's coming up. It's going very, very well. It's going to be on Oak Valley Boulevard. I forgot the address, but it'll be west of Wickham Road, right across the street from Waffle House. And there's a professional center there. We're very proud of all of the technology that we have. But within a space which I designed primarily in 1980 and then added onto it in 1982, it's still that kind of a space where we are right now. And we've been able to do an awful lot with our space. We've had consultants come in, we've had laboratory technicians come in, we've had dental supply companies come in, and they're amazed at what we've done with the amount of space that we have. But finally, we are building a space for our technology and for our doctors. This space we are right now was really designed for me and some assistants and hygienists. It wasn't designed for 3 doctors. And so we finally have a space that will be large, it will be efficiently designed, and have technology built right into it rather than our wheeling things in and wheeling things out. So it will be a state-of-the-art facility. We're very, very excited about that, excited about the move, excited to be able to to be able to practice in that kind of a space, which will be far more comfortable for patients as well as for us.
Well, it sounds like it's going to be tremendously exciting. You were joking about a for sale sign or something.
Yeah. I mean, anybody who goes down Sarno Road knows that we have a standard pan sign, and below that we have a digital sign. And we sold the building, the office building. Eleanor and I own the office building. We sold the office building a year and a half ago. And the people who currently own the building decided to put a for sale or lease sign right in the front of the building. Well, if you're patient, what do you think? So we had the digital sign. And so we took everything off the digital sign, our pictures, all the things. And it said, we're moving to our new office soon, so that people would understand that the building's for sale, but we're staying in practice and moving to a new and better facility.
Yeah, we've talked about this a lot, that you guys really have been bedrock kind of to the whole area for all those years. With the topic that we're talking about today is something called solid bite precision. And like you mentioned at the outset of the program, we've been talking about a lot the fact that this is like almost like the next chapter, that once again, you're innovating your way into as it pertains to dental implants, because what we said in the first half of the show, and I really encourage you to go back and find it, as I mentioned, any place good podcasts are found, helpingseniorsbrevard.org, YouTube, Facebook, however you get it so that you can go back and get the first part of the show. But we've been talking about the fact that you guys have once again innovated kind of a next step on how to really go after making dental implants even less intrusive and maybe even more cost effective than before through this solid bite precision. And we were talking about before the break some of what that actually meant. It minimizes, I'm paraphrasing, so correct me if I get this wrong, but it minimizes some of the amount of cutting and things like that you have to do to get deep into the jaws and things like that. So therefore, it seems like not only is it going to ultimately result in a faster healing time and getting things back to normal, but it's also going to then be more stable and the things that you're trying to do for the long run. And one of the points, Dr. Sheldon, you had mentioned was that the level of surgical skill absolutely makes a difference in this. Talk a little bit about that and what kind of training expertise makes all that happen?
In terms of surgical skill, our whole goal when we're doing surgery is to minimize the amount of trauma to the ridge or trauma to the mouth so that we retain as much bone and gum tissue as possible. It's, I used in the first half, I said finesse. It is a finesse type of surgery because we don't, as we talked about before the break, you can remove the teeth, you can cut away the ridge, and you can develop prosthesis that's fake gums and teeth, and that's what you do. Well, that takes a certain amount of skill. But to be able to extract the tooth and to retain the gum tissue around where that tooth was, that takes a lot more skill. And that's what we've always prided ourselves on that. I'm not saying that, I didn't try to do the best that I could when I was in practice. I did. And we tried to stay ahead of the pack. I think the nice thing, as a former owner, and now I'm, consultant in the practice, is that I can look at what I was able to accomplish during my career. And we have two dentists, a restorative dentist and a surgeon, who work together, and they've taken the lead. They've said, all right, Dad did this much. He moved it this far forward. We can't live on what Dad did. We've got to move it farther forward as well. And so they have the same goal. They want to make sure, Melbourne, Florida is Melbourne, Florida. But we want to be the leaders in the country of the things that we do. It's the reason, even at my tender young age, I'm still lecturing in other parts of the country. It's because we do things different. And it is that we do things different to do things differently. We do things differently in order to make a bigger difference to the patient. In our lead, in our lead services that we offer, which are now Solid Bite Precision, which, as I said, we've been working on 3 years, where it requires a great deal of finesse in order to be able to retain gum and bone tissue, in order to be able to create something that's more aesthetic and more comfortable for the patient, as well as our non-surgical therapy, which is periodontal endoscopy. Both of those are tissue-sparing procedures which require less surgery. In the case of the perio, it's no surgery at all, and actually a lower cost than what you would do traditionally for the other types of procedures. So I'm not saying what we're doing is inexpensive. It's not. But if we compare what we do to what others do, yeah, it is more cost savings. And that's always been our goal. What can we do to minimize the amount of treatment and get the maximum results? And I think with Solid Bite Precision, what we've seen with our patients over the past 3 years and working with this has just been nothing short of phenomenal, and those patients are thrilled with the results that they've been getting.
Well, like we talked about, you're always on kind of the cutting edge of the technology. Now, one of the things we've been talking about was, as a periodontist, I think, you really have this focus on gum and gum health. But as you were describing it, particularly in the first half of the program, this whole thing about, I didn't realize that to do implants, you're actually building up gum tissue, which I guess may be something I should have guessed at. But again, for the average person, and I guess I'm the average person, we don't really understand the ins and outs of it. But part of this is actually doing that in putting this together with Solid Bite Precision, right?
It is, and to build up the gum tissue, which is to form the scallop that we talked about earlier, where the tissue frame going around the tooth essentially defines how the tooth looks. That requires surgical precision. It also requires precision in the development of the temporary that we're putting onto the implants while we're guiding the tissue to heal in the correct position. So the temporary has to be absolutely precise. It has to leave room to guide the tissue into the correct position so that we end up with tissue that looks like tissue between natural teeth. So it is surgical precision, but understand now we own our own laboratory in Melbourne. And so we've got laboratory precision. And by the way, these are laboratory technicians that we worked with before we developed our own lab, and these are the technicians that we wanted to work with, and so we combined together in order to be able to create this surgical restorative dental laboratory team, all going in the same direction. And it's interesting, the leader of that team, of the lab team, is a prosthodontist. That's somebody who specializes in tooth replacement dentistry, and she is the one who runs our laboratory. So I love it. Kerry, I'll be 75 years old next week. Wow. And to be able to, and I started here when I was 30, and to be able to see what has occurred and what has developed and what the doctors, Dr. Furtado and my son, are doing in order to be able to do the very, very best they can. It is a dream of mine. I don't have to work. I'm doing fine financially, but it's a thrill to be able to be there. It's a thrill to be able to talk with patients, because that's all I do now. I talk with patients. That's what I do. I see most of the new patients that come in, and I'm able to help them make decisions. But to know that on the other end, the people who are doing the work are doing as good or maybe a better job than I did, it's just a thrill to be able to see that. Now with a brand new facility and the staff members that you've seen and others have seen, they've just been there, for years and years and years. Whether it's Danielle or Jennifer or Courtney, or a number of the people have just been there for a long, long time. It's a thrill to be able to see that kind of a practice just move forward, and everybody leading to to the benefit of the patient. That's why it's a thrill when I see the Google reviews and they say, boy, these are the nicest people I've ever met. I usually hate seeing this. I like coming here. I mean, just put the whole thing together, and it's a real thrill for me.
Yeah, I was going to say that's the thing we don't necessarily talk all that often about, but it is interesting because when you go to your dentist office, when you go to the office, it's quite an experience. I would say most people fear going to a dentist office, and yet you guys always work so hard to make it very comfortable and very welcoming and very non-threatening is probably the word I would use as people come into the office. I really noticed you guys work very diligently to make sure that people are having I guess I'll call it as happy an experience as they can with whatever is going on at the time. Let's continue the conversation about how Solid Bite Precision, this is kind of like a new program, and we've talked along the way about it, that as you move this to the next level, I think I know where this question is going to wind up with an answer, but because you said it's less surgery, I was going to ask you about the recovery time, right? Because with less surgery, you would think you would be back on your back. I wouldn't say back on your feet, but you know what I'm saying. You'd be back in action.
So if we could talk about less recovery time, yes, because the more incisions that we make, the more bone we cut away, the more the recovery time. So fewer incisions, less bone removal, or sometimes no bone removal, means a much more comfortable experience for the patient. So let's talk about the sequence of events that occurs. Number one, patient comes in and sees me or sees Dr. Furtado, sometimes my son, for the initial evaluation. So at that time, we're going to take all the x-rays that we need. Now, there's certain assumptions the patients have. I need to see them because I'm going to have my teeth taken out. And when I see them, I say, you don't need your teeth taken out. I think that's the first thing that's the first surprise when we see a patient. Say, you don't need nearly the work you think you do. Let's just do this, this, and this. Are you okay with that? And yeah. But let's assume it does go to the point of extracting teeth and putting in dental implants. We have to make sure the bite is correct, right? So I have to make sure the upper and lower jaws align correctly. And if we're only going to do one arch, I have to make sure that the other arch, the opposite arch, is going to have the correct curvature to fit the upper teeth. The last thing I want to do is make upper teeth that are going to fit malplaced lower teeth. And so we've got to look at that to make sure that the jigsaw puzzle is all going to fit together. So visually I'll look at that, but I'm pretty good at that. But then what we'll do will be to scan the upper and lower arches and put it on the computer so that we can look at your mouth on the computer. We can look at it from every different direction. For me, I'm confined by your cheeks and all that type of thing. If we put your a picture of your mouth on the computer, we can look at it from every direction. Once we've done that, we start to, on the computer screen, extract the teeth and develop the gum tissue and the bone tissue in the position where we want it if we have to add a little gum and bone. And we can see exactly where the implants will go. And the implants, of course, have to be lined up as precisely as they can be. And the implants have to go in the middle of the extraction site so that we have a tooth that develops from that extraction site that looks like a natural tooth. So that's all done on the computer. We'll then go to the laboratory and say, all right, this is where we can put the implants, so we're comfortable putting the implants. Laboratory, I want you to come up with a mock-up and a design of what you're going to do to be able to place teeth on these implants, and understand that we're developing gum tissue, and so we want to make sure that the area between the teeth is created in such a way that it guides the gum tissue in the correct position. So then we're working with Patty and her team in order to be able to create that. So on the day of treatment, our laboratory technician will be in the office on that day. And on the day of treatment, our anesthesiologists, we have board-certified medical anesthesiologists who were originally trained as a dentist. Steve Kifley comes up from Boca Raton. And he originally trained as a dentist, then went right to medical school and went to anesthesia. And we've been using Steve for over 20 years. And so he's part of the team on that day. So we have a board-certified medical anesthesiologist who's right there helping us, and we'll put you to sleep. On the day of treatment then, Dr. Kiffel will put you to sleep. We'll then do the things that we need to. And we still get you numb, by the way. We'll still get you numb even though you're asleep. And then we'll take out the teeth. And then using our surgical guide, whether it's a virtual guide or whether it's a guide that we fasten in the mouth, depends on the individual situation. We have to use fewer surgical guides in the mouth now because we're retaining the teeth where they are, and so the tooth socket is the guide, so we can place the implant exactly where the tooth was. Then we start to place the implants in place. Now, it doesn't just place the implants in place. We also want to harness your healing factors, and so we'll have drawn some blood from your arm, we'll spin that down in a centrifuge, and we'll take the growth factors out of that blood and then put that in and around the dental implant in order to speed healing around each of those implants. You'll be asleep during that time. So the extraction is done, the implants are placed, and you're asleep during that time. When do you wake up? Now, understand you're already numb. So we wake up when we start to fit the teeth because we want you to be able to open and close your mouth and move your mouth back and forth. We want to see how your mouth moves. And so Dr. Kiffel will then wake you up. Usually not fully, usually don't remember it, but wake you up enough that we can start to ask you to do some jaw function in order to be able to make sure that things line up correctly. When we do that, then if we need to do some additional work, we can put you right back to sleep. That almost never happens. We just work with you until we have the teeth lined up in the exact position when they need to. And the teeth are then fastened with screws to the dental implants that have already been placed in your mouth, and then you go home. Some people will spend 3 to 4 hours. If we're doing full mouth, we may do 7 or 8 hours. It's a full day in the office, and the surgery takes less time. It's fitting the prosthesis and getting the prosthesis, temporary prosthesis, where we want it to be in order to be able to guide the tissue correctly. That actually takes a little bit more time. And then you go home, you convalesce. Most people call us, and maybe they won't call us, but they're surprised by the comfort they feel. They expected things to be a lot worse. And that has to do with the talent of Dr. Furtado as a surgeon to minimize the trauma when the teeth are being taken out and when the implants are being placed in. So most people are quite comfortable. Sometimes there's a little bit of swelling, but there was more swelling when I was doing the surgery. Now we're doing a lot more work. Now, when we're retaining as much gum and bone tissue as we are, there's less swelling because there's less trauma to the tissue. You then wear the prosthesis, temporary prosthesis, and we want to make sure you're wearing the prosthesis long enough that the tissue has reached the correct position, and it's the final position before we make the final teeth. The last thing we want to do is make the final teeth too early and then see things shrink away. During that healing period, if we find the gum tissue is shrinking away, then we'll either make an adjustment to the prosthesis or we'll add a little bit of gum tissue through some of the sophisticated surgical techniques that Dr. Furtado uses in order to be able to recreate the gum tissue that may have been lost. Once we're satisfied, and you're satisfied with the way things look and the way the teeth line up, then we'll go and we'll do the permanent prosthesis, and then Patty and her team will work with my son, with Matthew, to be able to create the permanent prosthesis to match the temporary prosthesis. And then you're done.
Well, that's kind of like the front to back of it. We haven't, like we were talking about at the outset of the program, we haven't really talked about dental implants for quite a while. And this solid bite precision really does move this to a whole different level, both in terms of comfort and just ease of getting the work done properly. And then, just because it probably assists somewhat in keeping the costs, as reasonable as they can be. For listeners who might be considering implants, what do you want them to do as the next step? Do they do the Solid Bite Gives Back as a program to get in there and kind of get a full assessment, or what do you recommend?
I don't think that you can really decide what you need unless you've sat down and talked with us. And by the way, talk with other dentists, fine with me. But it is to call the office and talk about the fact that you heard us on this program or mention Solid Bite Gives Back and make the appointment. The appointment, routinely patients will say, I've never had that thorough an examination. Mm-hmm. And that's what I want to do. I do want to be able, this is all I do now. I do examinations and I talk with people. And it gives me an opportunity to be able to tell you, at least my impression of what the pros and cons are, because there are cons to every procedure as well. Not everything is 100%. We've got to talk about the plus and minuses of everything so that you can make the correct decision for yourself. I saw somebody yesterday. I hadn't seen the dentist for 10 years. And he decided to come in. He came down all the way from Titusville. Why? I don't know why he did. And he came down and I said, I almost was going to say you don't need a cleaning, but there's a couple of areas you need a cleaning. You don't need anything else. and maybe after that, you can go away for 10 years again. It's not how we make money. We don't make money on people who don't need dental work. But it is also a thrill to be able to tell somebody, hey, you really don't need us. And, we'll clean your teeth and then see you later. Everything's fine. The only way you get that is for a good, thorough examination to make sure that we're not missing anything. And then I'll tell you what I think you need, or the different alternatives, because there's different alternatives at different price points. And I want you to be able to understand what the denture would be, because the denture is far less expensive than solid bite precision. And so we can talk about all of those. We do them all, but and we have a lot of experience doing them all, so I can have that discussion with you. And of course, the staff members that are working with you are all trained dental assistants, so everybody's assisting me, and that's the examination part of it. Are trained surgical assistants who've done it and have done it for a number of years. One is a restorative assistant, so done it for a number of years, and so they can talk to you not just about what it is and how much it costs, but really what it is and what the patients and what you as a potential patient would be experiencing.
Well, sounds good. If somebody wants to participate in Solid Bite Gives Back, get some more information about everything we've talked about with Solid Bite Precision and dental implants and just overall mouth health, what's the best way to take advantage of that?
Well, you can call us at 321-259-8000 and tell whoever answers the phone, whether it's Amy or whether it's Lindsay or Jennifer, that you heard us on Helping Seniors of Brevard, and they will tell you how you can take advantage of that $50 donation for a full examination with all x-rays. If you're hearing this, as a podcast off hours, just go to solidbite.com and you'll be able to make an appointment right online.
Sounds great. We've been talking with Dr. Lee Sheldon, noted area periodontist, and covering all these great topics about Solid Bite Precision. Well, that is about the time that we have for Helping Seniors Radio on this week. Look forward to seeing right back here at 90.3 FM WEJF next Wednesday, 12 noon, same time, same station. See you soon.